Welcome back. A new report on health care costs in Utah shows that Utah's per capita health care costs are lower than any other state. That's the good news. But Utah Foundation President Peter Reichard is here to discuss what they discovered that's a big concern to a lot of Utahns. Good morning. Thank you for being here.
Thanks for having me.
Well, among this vast report, there are some price ranges that are here and here that you notice across the state. How come?
Well, it's something that the state is gathering data on now in the last few years, and we did find very remarkable variations from one hospital to the next for common procedures, and we couldn't account for them. Based on the data, there was no clear reason why those prices were so different from each other. So we think it's something that the public needs to take a close look at now that this data is being made available, and we'd like to also see the state continue its efforts to put more information out there so that the public can see what's going on.
So what surprised me is why are our prices lower? Why are we paying less here in Utah?
Well, because we're doing a lot of things right. We're demographically speaking, we're the youngest state in the country. In terms of our culturally speaking, we have a healthy, active culture. We're an outdoor culture. We have active lifestyles. But also, culturally, we tend to avoid bad habits that you might see in other states. You know, the smoking and the overindulging and that sort of thing. So those are factors. But also, our hospitals are doing a pretty good job of moving patients out quickly. The longer the hospital stays, and the more people you have coming to the hospital, the higher your health care costs are going to be. And we have the lowest rates of inpatient care and inpatient stays in the country.
If the food was better, we'd stay longer. But we get in there, we get out. Now, I spent a lot of time in Las Vegas. There's an aging population there, of course, over in Arizona. And the aging population seems to drive up costs. Where are we at over here in Utah?
Well, as I say, we have the biggest families, we have the youngest, we have the most children, and we have overall the lowest median age. So that does really help us quite a bit.
The red flag, what are you most concerned about as you digest this report?
Well, there are trends out there that have been moving, that are driving costs, and these trends are continuing. One of the most important, and this is a national issue, is medical technology and drug costs, and those are going up significantly, far outpacing inflation. Another issue is hospital consolidation. As competition is reduced nationally, and if we see more of that here, that consolidation tends to actually, with lower competition, drive up prices. And then also the administrative complexity. Doctors are spending more and more of their time filling out paperwork. One hospital in Utah had to double its administrative compliance staff after the passage of the Affordable Care Act. So red tape, it's driving up costs.
Red tape, red flags. Peter, thank you from the Utah Foundation. Good to have you here this morning. Lions